joined now by Lady Tureiti Moxon. Tēnā koe, welcome to Q&A and thank you for being with us.
Lady Tureiti Moxon, no Ngāti Pāho Wera, Ngāti Kahungunu Ngaita, who is Managing Director for Te Kōhao Health.
Lady Tureiti Moxon is a lawyer and Māori health advocate who also chairs the National Urban Māori Authority. Tēnā koe.
Lady Moxon, thank you for joining us this morning.
Lady Tureiti Moxon.
They don't get the services they need when they need it. They don't get the specialist diagnostic attention that they need when they need it. So they die young.
That from Lady Tureiti Moxon.
This diagnostic centre is there so we can be in front of the line and we can make sure that those who need to be seen are being seen. In 2018, we visited Ascot Mercy Radiology in Auckland, and we were very taken by what they were able to do in terms of diagnostics and early diagnostics. We thought, well, why don't we try something like that for the things that kill us the most? Cardiovascular disease, cervical cancer, breast cancer, lung cancer, and bowel cancer. Seeing that early diagnosis can be done to stop our people from dying of premature preventative diseases. And that is the key to this.
Pacific Radiology's joint venture with Te Kōhao is going to make a real difference for Māori health outcomes in the Waikato. And that's because we are improving equity of access, the service that's being delivered by Te Kōhao and ourselves. And diagnostic imaging is one of the best ways of improving health outcomes for everyone.
From its first conception, or the thought of it back in 2018, then of course the turning of the sod in 2022, and then, here we are, open. It's phenomenal that there is such vision and drive behind an idea, driven by need, being able to choose to go and access this kind of service. It's just made it so much easier, the decision to, because it's right there. It excites me to no end that when people just drive by there now and they wonder, oh, what goes on in there? And if they venture in, a barrier's removed. Why? Because what we do know really well as Māori is we know what it feels like to lose people.
It's great that it's in Papanui because maybe that's where it's needed the most.
It can provide early detection of the 5 biggest killers of our people.
Papanui, great people, great community, lady servant.
Yeah, I think the centre's a great idea because it gives our people an opportunity to be responsible for our own health.
Tēnā koutou katoa, ko Nicola Te Kiri tōku ingoa. This piece is called Wai Mauri, and it talks about the Mauri that we have within our wai, and especially Waikato awa. So this outside pattern, these high and whakarari lines represent the currents of the awa. The pieces within it represent some of the life creatures that used to be and still are in our awa. So our tuna, our kaura, and our inanga. And then this part in the middle is reference to the takarangi, so the beginning of life, to signify that life force. There's a lot of references to the awa, to water, and within water is a very healing element. So that's what my pieces connect to the awa, to the healing elements of water and wai.
In preparation of this, what have you guys been doing?
Well, we've been doing heaps. Very pleased how far they have come. Carvers in there that haven't had that much experience. They're a new group, but they've completed carving our Pope, ngā hauewha, tens of te kōnoa, te Kōhao, ko tari anō, te Kōhao, te ngira. Te kuhuna ai te miro mā, te miro whera, te miro ponga. Ko rātou, ngā miro. Hoki anō, ko rātou, ngā mātā waka. The kapahaka will then come into play in terms of supporting them with the kai waiata.
So we've been preparing for this from February, teaching weekly, every Wednesday afternoon, and it has captured a few people and their interests that they want to join. It has actually been a really, really good journey for everybody in preparation for this balancing, and I really can't wait. I'm actually excited for the day. Ready for the matatini. Too much. Cool. All right.
It's no surprise to me that this amazing building is standing here with the vision, remember, because it's the why behind what Lady Tureiti and Te Kōhao have done that's so important. It was always about, reversing those inequities, bringing healthcare closer to our people, right in the heart of one of the places here in Kirikiriroa that most needs it. And that for me is a real example. It's not over by all the other hospital buildings. It's right here in the heart of Enderley, and I think that's just testimony to who she is and the kind of kaupapa that she is driving forward. It's no surprise to me. I've seen our kaupapa Māori partners perform a lot with a little for many, many years, for decades basically, and this is just another perfect example of what a true mokopuna decision looks like when we're making decisions, planting good seeds that we know are going to benefit our people long past our time here in the kaupapa.
Now here's our opportunity. Train our own rangatahi up to be technicians, to be radiologists, to be doctors and nurses, to look and see whether or not this is a career for them as well. And this is our response, our resolution for taking care of our own health as being part and parcel of a health system that has traditionally kept us out. So that's our moemoeā, and that's our hope for the future for all our generations to come.
There'll be career paths that our young ones possibly never even thought about. And I'm thinking not just the diagnostics, but the therapeutic side of things as well. I mean, we have rangatahi who are creative geniuses, and to see themselves being part of something like this as a therapeutic healer, which the centre accommodates as well, that's a career pathway that they can be exposed to because it's right in their backyard. And not just that, the building is symbolically beautiful, representative of Māori, and wherever possible, those symbols and artefacts, if you like, are there to interact with and will provide a healing in themselves. And I think even that, just bringing it all close to the community, close to whānau, so it is their norm. It's possible because of the leadership in place, the backing of very supportive funders who believed in the vision, and a very strong team of people that are committed to their leadership. A lot of people have come and gone in this process as well, people that once were employed here but are no longer employed here. Their contributions were amazing, and it speaks to there's a time and a place for everything, a season for everything, and people whose seasons brought them into this project are valuable. I recognise that too. But yeah, the constant throughout this project is definitely our leader and the visionaries and the dream.
Oh, I think it's been inspiring. I mean, for a facility such as this to be sited in a community that the community that doesn't always have ready access to good health services, I think it's excellent. I do believe that this will be the start of a number that will be established around the country, because it is in the community where they have an ownership in it. There are private funders involved. It's a real success story driven by someone, Lady Moxham, who's absolutely committed to ensuring that the Māori receive the best in healthcare and when it's most needed.
It's not going to be the first one. There will be others that will come along and do the same. What this tells us is that there's nothing that prevents us from doing what we believe needs to be done, not just in terms of our health, but in terms of our dreams, our hopes, our moemoeā. And certainly, with the team that I have had, and we have been together for such a long time, they're my team I pick every time. So whatever the future holds for all of us, I'm sure we'll all be in the room at the same time, at the same place. So, kia ora.